Hi, everyone. Welcome to ToniTime, where solutions are just a discussion away. So today we're going to talk about what I'm calling the art and science of medicine or healthcare. And this conversation is inspired or sparked by a recent Reddit post from a new nurse. And so I'm just going to read the post first and some of the responses and see where that gets your head, kind of where you go with that, and tell you my thoughts. So let me just read it to you. I'm a new grad, 4 months into my new job, and I think I may have walked into the most I'm a nurse because I am passionate about helping people unit that there is. I'm struggling because I feel like a fraud. My passion is not helping people through the worst moments of their life. I am sympathetic and respectful and kind, but it is not my reason for being a nurse. I'm a nurse because I'm interested in the science, the pay, and the wide range of opportunities. I need to get at least a year under my belt, but I'm already dreading my shifts. How do I stay true to my why when I'm surrounded by what feels like altruistic saints? So it's like, whoa. I mean, I read that and, I am one of those nurses who often, feels like nurses are calling and we're there to help people be their best selves. And so I was, a little taken aback and surprised reading the post. And so I dug into the responses. What were some of the people saying? Lots of responses around, yes, it's about, it's just a job. It's about the pay. It's about the opportunities. Let me just read a couple to you. It's the best ADHD job. Whole day is planned out for you hour by hour. Don't typically have big projects you have to plan for weeks in advance. It's almost entirely, here are the defined tasks. They need to be completed right now. Go and do them. Another, you're not a fraud. All the Florence wannabes you work with are. Trust me, nobody puts up with all the S and abuse from patients, families, and administration solely out of the goodness of their heart. They are all here for the same reasons that you are. It's interesting at times, yes. Tolerable, pays decent, and offers job security. I've always said that with a clean license, a nurse can get a job anywhere at any time. Might not be the job you want or like, but it will keep you from being homeless and hungry while you find what you want. And then a final one I'll read to you. I'm a nurse because I know I can do a lot of things that people can't. I hear it all the time. Good for you. I couldn't be a nurse. I'm a nurse because I can be. I'm good in a crisis. My brain is a sponge for knowledge. I'm passionate about preventive measures. And above all else, I really like people. I'm a people person, and I know I'm able to help them with things that most would be sent into a coma for. So I was like, okay, so wow, if you're a leader on a unit or in a department or in a clinic right now, you probably have some team members who have these thoughts right here. But I wonder, one, if you really even know that they have these thoughts because they're not sharing those publicly. So let me just start by saying, as we talk about art and medicine of health, I do believe that medicine is this blend of art and science, right? And so if this is the case, can you really practice at the highest level if you only practice the art and no science? So you only practice, or maybe the opposite, you only practice the science and not the art. I mean, we would never think of only providing the art of medicine, only compassion, only courtesy, only respect for our patients. So why would we consider providing only the science of, maybe it's assessment and treatment and medication, things like that when caring for our patients? I propose that it is only when we combine the art and the science do we really see the best outcomes for patients and families. Now, I'm not saying this has to be a 50-50 split. I'm saying it has to be the right combination that meets the needs of that patient to increase the chances of achieving the desired outcomes. And the desired outcomes would be helping this person to be their best selves, whatever that is and whatever that looks like. It's also decreasing readmissions so that they don't keep coming back into our emergency rooms and our clinical units. So those are some of the desired outcomes that we want for these, patients and families. So what do we do with that? I mean, one, I'm interested in hearing your thoughts, in the comments below so we can have some discussion around your thoughts. My thoughts went first initially to how do we make sure we are getting this type of feedback as leaders in our organizations, in our hospitals, in our clinics, in our medical practices, wherever you serve. How are we making sure that we get continuous anonymous feedback? So those who know me, I know I'm a fan of using the technology. So why could we not have a QR code that's placed various places across the unit or practice, including where they clock in and clock out, all those areas where they can scan the code and literally put in any feedback that they want to. Maybe it's just an open-ended question. They can access it on their phone. We're not asking any identifying information. Now, I know that we have, the surveys where, they are anonymous, but at least go to that unit and or department. But I guess I feel like more importantly, I want the information. I want the feedback more than I want some of the attributing factors, so that I can hear things like this. And I can come back to the team and say, hey, one of the things I've been hearing, and I really want to work on this. Help me. Maybe if you have a unit practice or you have some engaged people in your practice or clinics, so you go to them and get some feedback. But one, I really think continuous anonymous feedback. That would be one of my first go-tos. And then secondly, how do we let everybody know that all skills are needed and desired in order to make us the best department, the best unit, the best practice, the best clinic possible? We need those who are more scientifically minded and driven. And we need those who are more art and passion and calling driven, because it's together how the person who's maybe more art and passion driven, how do they make sure they're incorporating enough of the science piece of the work, the medications and what they're for, and how they interact with their body and with other medications. What are the side effects? They need that piece along with the compassion part around, I know this is really hard and it's a lot of information. So I will be stopping intermittently to find out what questions, not if you have questions, what questions you have. So thirdly, create opportunities in small group sessions that talk about compassion. And so one of my favorite books, Compassionomics, read it. Look at some of the tips in there. Look at how you incorporate that into some of your work. Provide opportunities for them to understand how to combine the art and science of medicine, and not as an extra while they're doing work that they normally do as their interaction and serving and caring for patients and families, and intentionally connect the dots to the impact on clinical outcomes, to the impact to safety, the impact on falls, the impact on UTIs or central line infections. So connect the dots to clinical outcomes so that team members are able to see how the art and the science produces better outcomes for all. Finally, as a leader, walk the talk. Be around there with your teams, listen, learn. You also have to show and demonstrate that art and science balance so that they see it lived through you, and then they're able to see that how they can then use that balance, whatever that balance looks like, with their own patients and their own families. So I'm looking forward to hearing your thoughts, your feedback, your ideas, your suggestions, all the things. Put them in the comments below. Remember to like and subscribe to this channel. So until next time, this is ToniTime, where solutions are just a discussion away.